Exactly, because if we make a mistake, then that could be an unsafe decision. It could bring harm. We're finding that demands are higher. People have much higher expectations from their GP. We're seeing a lot more GPs becoming more burnt out. I realised that my hobbies and interests were falling behind. I had lost a little bit of myself outside of medicine. It's not an easy job. There's a lot of emotional burden, but at the end of the day, we are also humans too. If we can take time to look after our hobbies, look after our interests, look after our family and friends, and do what makes us happy, then we'll come back to work feeling refreshed.
Hello and welcome to another podcast with Social Untold. This is where we bring you stories from people from different areas in life, different professions. Today we have Harnek Kailey with us, who's a London-based GP and also a Instagrammer. Is that the word? Or
A health content creator.
And health content creator. So without any delays, let's get into it. Let's welcome Harnek. Welcome to our show.
Thank you.
How are you today? How was your travel?
Great. Yeah, it's not too bad. Drove down from Wimbledon.
Super. Okay, Harnek. This is, we've usually interviewed doctors, we've spoken to a lot of healthcare experts, but we usually focus more on their specialty, on their profession more, rather than how they are where they are and their future aspirations. With you, this is something that I want to really understand. And starting from, let's go back and start from why choosing this profession, why chose medicine, and then why did you specifically choose GP? Was that a choice or that something just happened?
Yeah, it's a good question. Why did I become a doctor? Well, I think being South Asian, it's kind of growing up, you're always told to do a profession that you do well in, and it's always perceived that things like medicine, law, engineering, economics would be professions to go into. But I kind of actually went off the path and wanted to always be an actor. That was my initial sort of where my journey started at school. I still did well in my academics, but then ended up going to drama school alongside my normal school. I even went to the States for a little bit and did some sort of casting calls and work in film and TV.
Oh, wow.
And funnily enough, actually, my parents fully supported it. They were very much of the mind tune of, enjoy your hobbies, enjoy your interests. And as time went on and as I had to make the decision about career and about sixth form and about university, I think I realised it was much more of a hobby rather than actually a stable career, because I wasn't getting work. I actually found it was messing with my emotions and mental health too much. And ultimately it came down to luck. It's more about your appearance rather than actually the skill that you had. I was often told I was too tall, or I was too thin, or I was, I wasn't the right fit for the role. But ultimately it came down to the fact that I knew I enjoyed my sciences, and medicine does give me a bit of both. It allows me to still be creative and yet still have a stable career and give back to people.
Super. So that was going to be my next question. If it wasn't medicine, what would it have been? But you have answered it already.
Yeah.
It would have been acting. So going slightly off topic, or not off topic, but away from our plan. If you were given a choice now and you found an option to go into acting, there was a chance, would you do it?
I don't know. I don't think I would. I think ultimately I very quickly realised it was a hobby of mine that I really enjoyed, and I still enjoy to this day. And I wouldn't change anything for being a GP. There are lots of challenges of working in NHS. There's lots of challenges for being a doctor, especially in the current climate. But at the same time, the job satisfaction that I get is next to none. But I'd also say by starting out and doing the health content creation, that's allowed me to sort of go back into the creative sides of acting, because a lot of it involves planning about what content you're going to film and what health topics you might talk about, or what sort of storyline you want to showcase online. So that's where the creative side has kind of crept in.
Kind of
And
marrying in.
yeah, exactly.
So we'll talk more about that in a bit. Now, how is it? I know you haven't got experience anywhere else in the world as a GP, but from when you started to where you are now, how has the industry changed for GPs? How have things moved on since from where you started to where you are now?
Yeah, that's a good question. I'd say overall, I think there's just been more challenges. So we're finding that demands are higher. People have much higher expectations from their GP. On top of that, the number of GPs, the number of patients has hugely increased. So if you look at 20 years ago, you probably had on average about 1,500 patients per full-time GP, whereas now you're looking at over 2,500. And there has been, and there always has been, advances in medical technology and in the healthcare systems. But as a result, it means we're picking up more conditions. We're finding there's more complexities to conditions. We have a more aging population. So that increases the demands that we have to manage as GPs. And there aren't enough, unfortunately, which is why we're seeing a lot more GPs becoming more burnt out. We're seeing a lot more GPs going part-time in order to get their right balance. And the other frustrating part is that we don't have enough, yet we're having people struggling to get into training jobs because of the bottleneck situation that we have. So it's just a bit of a catch-22.
So what I usually find is that, my opinion, what I've seen in recent years is you get the same number of people are coming out of medical school, right? Or in fact, there are more now than there were before. But fewer of them are going towards the GP side. More of them are going towards specialties. Is that the right assumption?
I wouldn't say so. I think if we look at the training and competition ratios from 2025, I think all specialties, we're seeing a vast increase in the number of people applying, but the number of jobs hasn't changed. I think what's happened in the last few years is that actually there's been a huge increase in the number of people that are looking to specialise, and whether that's in GP or within a hospital training job. So I'd say from the position of the number of training specialty jobs that there are versus the number of GP jobs in their own community, I'd say overall the numbers have increased regardless. I think what we're seeing is actually the competition ratios have increased across all specialties, and it's about how do we manage that, which is why there has been some changes recently to the recruitment process this year, and it will have a knock-on impact on both UK graduates and also IMGs too.
Okay. So now going forward, do you see that improving, or is there a way that it can be improved? From somebody who's working within the industry, within the area, so you could say that, okay, this could be done better. We could improve. What are those ways? What would you do to make that improvement, to make that change?
Yeah, I think ultimately it comes down to funding. I think that's the main issue here. And we need more jobs across all specialties, across all trusts. We need more specialty trainees, and we need more GPs as well. How do we go about doing that? It's about increasing the number of spaces. I think in terms of the recruitment process, yes, there has been a change with the prioritisation bill. It's only just come into effect this last month, so it will impact IMGs too. But how that's going to work, I guess we'll have to see in this current recruitment process. But the unfortunate situation we're facing is it is a bit of a bottleneck. We have lots of gaps in vacancies across the country. Yet at the same time, from a primary care perspective, there aren't enough jobs to go around. We've had GPs in the last couple of years who are struggling to find jobs, We've got GPs recently being made redundant
Yeah.
because practices don't have enough funding for them.
Yeah.
And yet at the same time, we've got all these GPs who are getting burnt out because they're seeing too many patients. So it's just about getting that right balance. And I think there needs to be some changes with the policies made.
Okay. So how GPs are seen in the UK and how they're seen overseas. What do you feel, so especially for the IMGs where you've got experienced GPs or practitioners coming from outside UK, what do you see main differences in the practices when they come that they have to adapt to here that they weren't used to over there, and so on? So if you can...
Yeah. I think in terms of, especially in South Asian sort of heritage, we have this perception that doctor knows best. You know, you'd listen to your doctor. There's a traditional approach, and you're almost told, okay, this is what you're going to do as a patient. This is a treatment. This is a scan, and this is the medication. There's no sort of to and fro. Whereas here is a lot. We're trying to go away from that sort of traditional medical approach. It's more about shared decision making, and we want to enable our patients to have much more engagement in their management plans and be more proactive about their health. So it needs to be more of a collaborative approach about what the steps are, and I think that's the key part in terms of how the consultation style should be. In terms of how family doctors are different, I guess it's especially in South Asia, it's very much private sector is the main section of healthcare.
That's
you know, you'd see a doctor, you may go straight to a specialist first of all, and the expectation is that you're going to come away from that with exactly what you asked for, whether that's a scan or whether that's a referral or a treatment procedure. Whereas here we're very primary care focused, so the idea is that you'd see your GP first with an intention to sort of make a collaborative plan about what to do, and a lot of things can be dealt with via GP. You may not necessarily need to see a specialist. So it's just about understanding the difference between the healthcare system.
I'm smiling here because it just reminds me of a story. Back in Pakistan, I saw a family member of mine. He went to a doctor, and I said, "How was the trip? How was the doctor?" and so on. What happened? He wasn't a very good doctor. I said, "Why?" He didn't give me enough medication. So that kind of every time I look at our GP practices here and how treatment plan is made, and then I compare it, that's the only thought that comes to mind, that if it was somebody from Southeast Asia, South Asia, that's the first thing they'll have. Oh, it's not a good doctor. He didn't give me anything in treatment. He didn't give me any medication. He didn't give me any antibiotics. And that I feel is the biggest difference, isn't it?
Yes, absolutely. I mean, people often come away from the GP surgery thinking, well, I didn't get any antibiotics or I didn't get any medication, so therefore it was a waste of my time. But actually the key part was, well, what did you discuss with your GP? What sort of take-home points can you do about making an active sort of self-health promotion, or make it actively encouraging people to take ownership of their own health. And that's the other element, is when you do offer medication, then they won't take it. Because then the other issue is, well, if I take medication, I'm going to get side effects. It's going to make me more ill. I think that's the key part, is what I've learned, especially about seeing South Asian patients, is when we're trying to focus on preventing health problems, especially things like diabetes, high cholesterol, high blood pressure, and these are the conditions that affect South Asians more so in particular, that they often won't take medication because they're not having any symptoms. And often these conditions are asymptomatic until things get too late. And they may want to take a preventative approach or take home remedies instead, which is absolutely fine to do, but it's about having that conversation with your GP about why is this medication needed, what are the side effects, and how the benefits of taking the medication probably do outweigh the side effects. And if they don't, well, then we can change the management plan accordingly.
Okay. Now, talking about home remedies, I think the new problem is AI diagnosis, where people go and put in their symptoms in any AI mode and get a diagnosis, and they come and say, this is what this is what we know. We know this is our problem. Now, how do you deal with that?
Yeah, I mean, we see it a lot. We see a lot of Dr. Google coming in, and I think ultimately it's a good thing. It means people are worried about their symptoms that they're having. They're having a look to see what the problem is. As long as you come in to see your GP and say, listen, do you know what, I can admit I've had a look online. I think these are things I'm worried about, but these are symptoms I have, rather than the expectation of saying, actually, these are the symptoms I'm having, so it must be this. Because Dr. Google can't beat the clinical sort of expertise that we've trained to be. You know, I've trained. Well, to be a GP, if you go as a run through, it's up to 10 years at the very minimum. And I think AI definitely has a place. Especially, I know that ChatGPT now has a health section, and it's great for people to understand more and be more engaged about their health, and especially to improve their health outcomes. But in terms of the expectation, we can get a lot of worried as well, because the first thing they'll see is a type of symptom, and all in red will be cancer. As the first few websites, and it's like, well, how do you manage that? How do we try to manage their expectations, but also work out what the real problem is? And that's the key art to it.
So, looking at the other side of this now, what are the benefits of AI, or do you see benefits of AI going forward in the future for the healthcare industry, for clinicians, for nurses, for other healthcare staff? What do you see as benefits? I mean, I see a huge importance of it, especially in reducing administrative times. But do you see more of it in terms of support with clinical decision making as well in the future, or no?
I guess we'll have to see. It's ever evolving, as is AI within the healthcare industry. I know that there's a lot of work going on behind the scenes in different areas to see how it can help to streamline, especially both administrative and clinical workloads. At the moment, we are using AI in primary care. So one of the benefits we have is some practices will use a AI transcribe to record your notes. And I think that can be really helpful, not for all consultations, but for some in particular. It will allow you to sort of focus directly at the patient rather than trying to type at the same time if they've got multiple problems or multiple issues. It can quite easily help you to create referral letters based on the notes you've created. In other ways that we use it, AI can be used to file normal lab results, which can be helpful. It can also be used to file hospital letters as well. So it will help to pick up and summarize letters that come in rather than having to trail through pages and pages. And then also it will give you an action plan, etc. So there is definitely a place for AI to help with the workload. In terms of clinically, I think it's just something we'll have to see.
So we are still quite a long way away from that point.
I think so. I think nothing can replace, and AI won't be able to replace a GP, because I think a GP sees a holistic approach. You have the patient in front of you, and even if two patients came in with the same diagnosis, they both came in, or the same presentation, let's say they both came in with 6 weeks of fatigue and feeling run down, the outcome of that consultation won't be the same for both patients. Whereas AI may not be able to pick that up depending on what the issue is. You've got to think about their social background, think about what stresses they're having, why have they come in that day. You've got to respond to how they're looking. So pick up on the visual cues about, where is this direction leading? Because it may be something completely different. And often patients come in with initial presentation and it's nowhere near close to what the actual problem is, because they already feel vulnerable coming to see their GP, so they may not want to bring up the real intent as to why they're coming in. So I think in those instances, and also in mental health, it can be quite tricky to think about how AI could help.
Okay, so talking about the administrative work that AI can support with. Now, you've also touched on GPs working extra hours, overloaded with work, burnouts. Now, do you think that's an area where this can help improve? the workload, reduce the workload on GPs, reduce the workload on clinicians, because how much of your time, let's say, is administrative and how much of it is clinical?
Absolutely.
In general.
I mean, I think that's the thing with GP. There's a lot of admin work that you need to do, and that's the thing that keeps you running late or falling behind. And the patient may come in for 10 minutes, but there's so much work to do around that, whether it's sending off a referral, looking at their results, or doing some pre-work to see what conditions they have so you can prepare for the appointment. I think ultimately AI will definitely help with the administrative workload. Whether it will help to reduce burnout, I don't know. I think at the moment, with how I'm using AI in primary care, it's definitely helpful in some situations, but I still find that my working day, I'm leaving at the same time, starting at the same time. So I think in an ideal world, it'd be great if it can, but
it's not there yet.
I don't think it's there yet.
Okay. Now, so coming over to the demands from a GP and the work that you guys do, and how much you've already touched on that there's a lot of pressure on primary care at the moment. How do you manage your personal life along with that, and your mental health? I mean, that it can take a toll when you're doing the same thing. It's repetitive.
Yeah. It's been hard, I have to say. I found that the jump from being a GP registrar to being qualified was huge. The sort of expectations, the responsibilities, the workload massively increased. And I noticed, so I qualified about 7 months ago, and I noticed that to begin with, I thought I was managing okay. And then quite quickly, I realised that my hobbies and interests were falling behind. So that's where I started to notice that I needed to be prioritising my time well, scheduling my non-negotiables. So whether that was the gym, or for me it was playing rackets, whether that was tennis or paddle, or seeing friends, or even my family. It was about making sure that I had time to do that and prioritise that. So, for example, with my admin, I would make sure I do all my urgent tasks on that same day. If anything could wait, then that will wait behind, rather than staying extra hours, because then that would eat into time where I would be going to the gym or spending time with my family or friends. Yeah.
So now that's your experience.
Yeah.
That's what. Do you feel that all other GPs, your colleagues in other areas or in do you feel that they are all going through the same thing?
I think, largely speaking, yes. I think a lot of GPs generally feel frustrated. Whether they're burnt out or whether they have experienced burnt out in the past, I think it's more common than we realise. Recently online, I shared a post about my reflection of the last 6 months of being a GP, and I was contemplating whether to post it or not, because it may be quite vulnerable. It probably shared an experience that people weren't expecting, because usually my online sort of videos are quite positive. They always try and reflect a happy environment, because I do love the job, but the amount of responses that I got about feeling burnt out with the workload was phenomenal. So many GPs and so many GP trainees and resident doctors had reached out saying they were feeling the same way, and they hadn't shared it before, or that they had also took a break at some point in their career. And ultimately, it's not their fault. It's not our own fault. It's a system issue. So where has the system failed for our GPs or our healthcare professionals to be experiencing burnout, to the point where I think last year about 40% of GPs in a survey had mentioned they had some symptoms of burnout. Because it's such a common presentation, well then how do we tackle it? Where do we go from here?
So do you think it's taken seriously by people who are not clinical or from the medical profession? I personally think it's not.
Yeah.
I personally think it's not taken
Yeah.
seriously because we don't somebody who's not doing the job, who's not in that. I mean, I've worked in A&Es and I've seen how stressful that can be, but from a clinician's point of view, I think it's very different. From administrative, you can make a mistake, right? Albeit that yes, not, but you can make a mistake. There is that, but from clinician's point of view, I feel that there is no margin for error.
Exactly, because if we make a mistake, then that could be an unsafe decision. It could bring harm, and obviously our intent is never to do that. But we're making decisions about people's healthcare, about their lives, and what you don't want is to end up in a situation where you lose the joy in your work, where you then no longer feel that you're confident in the decisions you're making based on the symptoms you're feeling and because of the stress and the burnout. So from a public perspective, it's very tricky because they see GPs, they see healthcare professionals and doctors as doing a duty, looking after the public and working for the NHS. But at the end of the day, we are also humans too.
Absolutely,
we have to look after ourselves, and I think that's where I think that's where the boundaries get blurred, because you want to do your best, and obviously in the news you see that people are struggling to get an appointment and struggling to see their GP, or they're on a long 18-month wait list just to get an outpatient appointment. But at the same time, you also then see that doctors are striking, and because there's not enough jobs or because of pay. So naturally you can see that both the public and health professionals are both unhappy. But it's about understanding why, and equally it's a central system issue. But I think this is why it's even more important for health professionals to realise that they do need to look after themselves, because if we can take time to look after our hobbies, look after our interests, look after our family and friends, and do what makes us happy, then we'll come back to work feeling refreshed, and feeling more compassionate, exactly, and feeling more focused to be able to do the job that we need to do and do it safely.
Yeah. So I feel that the gap, the biggest gap is misunderstanding or not understanding what the clinical side or the medical professionals have to go through and their daily tasks, for example. Because I remember we had a GP in Southwest London, and he used to take a break of 2 hours during his day, and that would be every day. And what I would hear patients in the waiting area complaining about, why does he need to take a 2-hour break? We only get half an hour break. But what they didn't understand is that he was using that time to do some of his admin work.
Yeah. So there is a big misconception about what do GPs do in their day, and that's also part of the reason why I share a day in the life as a GP online, because a lot of the work we do is behind the scenes. So let's talk about the structure of a GP day first of all. So an average GP day is probably about 10 hours contractually. So within that time, it's broken up into sessions. You may do a morning session and an afternoon session. And within that, you'll do a 4-hour clinic on average, but then an hour of that will be dedicated to admin. Now, admin time and your lunch is basically kind of blurred into one. So let's say a morning clinic is from 8:30 till 11:30 or 12:30, but then your next clinic may not start till 3:30, for example. So yes, there is 3 hours in between, but those 3 hours are spent doing all the lab work, doing all the referrals, looking at all the hospital letters that come in, speaking to colleagues, having clinical meetings, and that list is endless. So although what the public may see or patients may see is that they may be in and out within 10 minutes, there is so much more that goes on behind the scenes and so much more to the role. So it's really important for not only the public to see that, but also for other aspiring GPs or other doctors to see what does your role entail, because there is a huge admin workload to deal with, and there is that expectation to do it.
Okay, before I move on to more interesting part of your life, one question: when you started and when you chose or decided you want to become a GP, was the job? So this is talking about expectations. So was it closer to your expectations, the role itself, or the how demanding it was? Did you know this is how demanding it was going to be? Oh no.
Yeah, I think that the real shock was changing from being a trainee to being qualified, because I think that's where the real shock of how much
The
of
number
the
of
admin
responsibilities, yeah.
and responsibilities you have, that's when it really hit. As a trainee, you're still quite protected. And I did actually move on to a similar salaried sort of template in terms of how your workday would look like in the last few months. But I still didn't really fully appreciate how much of the admin that there was, because what you do is you'll become a named GP, you'll take on a list of patients, so you'll take on all of their admin as well. You may be covering for other colleagues whilst they're away on leave. You may also be having to we may also have to cover for locum doctors and review their results. So all these things take time. And as a trainee, you may be a little bit protected from that. In terms of the sort of emotional demands and the burden of, the clinical expectations, I guess you kind of are trained for that over time, but you're always learning. You're always learning. There's always going to be presentations you see that you haven't seen before. And it's just about being able to adapt and learn with time.
Okay, super. So let's now move over to your hobby. Is that what you would call it? If that's what you would call it, content creation. How did that begin?
Yeah, so I started my sort of the London GP page about 7 months ago. It was around the time where I qualified. Prior to that, I did have a public Instagram anyway, but it was just more related around sort of lifestyle and travel. And yeah, I think I didn't actually know why I wanted to do the page initially. I knew I wanted to go into I knew I wanted to have a platform where I talk more about GP and health education. And I think as time's gone on, I realised actually how important it is to have more medical professionals promoting health education online, because we're in an era now where everyone is on their phones. I remember there was a time where I was on a train during rush hour and every single person around me was just scrolling, looking at videos either on YouTube or TikTok or Instagram. And I was just thinking, this is crazy. However, we always want to make sure that our public are informed. So why don't we use our platform, use the knowledge we have to, give the public more information and empower them to make more decisions. So yeah, I think that's the idea of why I wanted it to start creating content online. And also it was about sharing a perspective of what a realistic day of life is like a GP, and also that you can also have a life outside of GP. So I do also share bits about whether I'm going on holiday or what I do day to day, just to make it a bit more human.
Okay. So now, within this, when you're creating these videos, do some of your patients, do your other colleagues, what are their thoughts? What are their views on it, if they've seen it? Or?
I'd say generally it's been quite well. It's been very supportive, especially from colleagues. I'd say you're always going to get negative comments or hear about negative comments, and I think you just have to block that out. And overall, I think the experiences from other colleagues and even other healthcare professionals who are online in the content creation space has all been quite well received. And often the people that do provide negative comments it's often because they just don't understand. They're not aware of what the purpose is, why we're doing it. And I think in an era where everyone is on a digital in a digital space, I think we need to encourage more people to provide useful information, accurate information, that's going to help people.
Okay. Now, what's the so your favorite feedback or comment that you've had, and the kind of the most negative feedback that you've had, if you would like to share?
Yeah, I'd say the most positive feedback, I think, was probably when I shared about my 6-month reflection about being a GP, where I was openly talking about feeling burnt out.
Mm-hmm.
I was also sharing my comments about struggling with sort of some personal issues as well. And it was just really nice to see how many people were relating to that. It was nice to see. Yeah, so that's the most positive feedback is probably due to the six-month reflection that I posted about online, and the number of comments I'd received saying how much people related to the content and to the symptoms of feeling burnt out. I was mentioning that I was dealing with issues with life stresses at the time, expectations and society pressures about, you know, almost turning 30 and needing to settle down and be married, especially from South Asian heritage, and the pressures that can involve at that time. And so many people reached out saying that they related, and that they were really inspired by the content that I was producing and how much that they related to it and how much that they felt it was really in tune with their own lives. And that really spurred me on to think, actually, do you know what? There is a real purpose to this, because people are following it, they are engaging with it, and they can really relate to it. And I think it's about, you know, putting yourself out there. It's a tricky one. You know, I'm putting myself out there, putting in a vulnerable position online in a public space, sharing my day-to-day life, and that's not easy to do. I'm still learning day to day, even now, about what that journey is going to involve. Where do I want it to go? What's my real purpose with it? And I think it's just understanding it was always intentionally to be a bit of fun on the side, and you know, over time as it grows, we'll see. Yeah.
You'll see where it goes.
Yeah.
So now coming to the negative one.
The negative comments.
So they're usually the funny ones, right?
Yeah, absolutely. And I think you have to take a bit of a pinch of salt. And you know, I don't sit there and think, oh, okay, you know, this person's saying that. But sometimes, for example, the most funny one is probably where I would be doing my day in the life and be talking about, okay, let me start this one again. I'd say the funniest one is probably that I shared a day in the life video, and it was also shared with the Royal College of GPs as well. And they were very supportive. They wanted to use that as a platform to get more GPs to share their insights. And I remember there being one comment from an individual basically saying that this isn't representative because I don't see any wife or kids in the picture. And I was like, well, just because I don't have a wife and kids at the moment doesn't mean it's not representative. Everyone can have their own version of a day in the life. And just because that may be your day in the life doesn't mean that's my day in the life.
Wow. Okay. So that brings us over to the next section. This is where I want to talk about mental health, especially of, as you said earlier on, that, you know, sometimes people forget that we are humans as well as medical professionals. You go through stresses of life just like anybody else. You go through physical medical conditions, you go through mental health conditions. So how much of a problem is that, one, especially in young GPs who are starting new, it might be overwhelming for them. And again, they've got to manage their personal life, their personal goals, their social goals, as well as their professional goals. So let's talk about it that bit. Like what does, how does that affect?
Yeah. I'd say, to begin with, it's not an easy job. You know, there's a lot of emotional burden, there's a lot of responsibilities, and there's privilege in being a GP, and especially with the conditions and the people that you get to meet and treat. However, as a result, it can have an impact. And if you're already struggling, then that can also exemplify. So it can seep into your work, but you don't want to let that happen. So it's about trying to protect your own health first and remembering that your own health takes priority first and foremost. And that can be really hard to do because especially when you're starting out, you know, the way we are as humans, as doctors, and the way that we are trained is that we want to help people. We want to put others there first. But it's in these situations where you have to look after yourself at all times. And the main things when you're starting out in GP is that you can get imposter syndrome, where you're always thinking, you know, am I qualified enough? Have I had enough experience to be managing this? Am I doing the right thing? Where you're questioning your decision making, because it is you in the room with the patient. So although you're working as part of a team, it can also be, it's very much an individual job at the same time too. So I'd say the most important part is to probably manage your time effectively. Make sure you've got time to take a break, whether that's having a half an hour walk at lunchtime or even just spending time with your colleagues, because what you don't want to end up doing is spend the whole day in one room isolated. I'd say the other thing is making sure you schedule time for your non-negotiables. So that's spending time doing your hobbies, doing the things you love and enjoy, taking leave at appropriate time intervals. And when you are taking your leave, is using that time to relax and enjoy yourself or go away on holiday. And if it is starting to affect you at work or even just day to day, and it is affecting how well you're performing at work, or if you're falling behind with your workload, you need to speak to your team as soon as possible, because it's very much a team environment, and you need to lean on your colleagues for support and to see where can changes be made, or can someone, especially early on, is there someone who can help be a mentor that you can check in on from time to time to see how you're getting on? And if that's not enough, then the next step is you definitely need to speak to a GP or get support from the team at Practitioners Health, or even from the BMA as well.
Okay. Well, now it's going to be slightly a more difficult question. You may want to answer it, you may not want to answer it, but this is from personal experience that I've seen. Reactions of senior medical staff, senior fellows, senior GPs who have been doing this role for 20 years, 30 years, and who'd come and say, you guys are too weak. We were doing it when we had to do everything by hand, when we were looking at, we didn't have all of these facilities that you have. And why do you feel burnout, or why do you feel these stresses? Why do you feel under pressure? Because you are not doing what we did. You are not trained as hard as we were. What is your response to that?
Yeah.
So first of all, is that a correct assumption? Is that something that still happens? I hope it doesn't, but I mean, this is from my personal experience and my observation. And secondly, how do you respond to that if that happens?
Yeah, I guess one can only assume that it probably does still happen. I think it may not be vocalized as much anymore, but it may be a perception that it's still there. And yeah, I mean, there definitely is an element where things were different at different stages. But I think there was different burdens and also different challenges. So, for example, let's say, 20, 30 years ago, yes, they may have worked longer hours. People used to do 24-hour shifts, weekend shifts, where they wouldn't leave the hospital and do all-nighters. But that's also because there was a different number of patients coming to the hospital. Whereas now the issue is that, we don't have enough hospital beds. We have people being treated in hospital corridors. Yes, we have more staff numbers at times, but it still doesn't meet the demands of what we actually need in terms of numbers because of the number of patients that are coming through the doors. So I think is all kind of relative to the challenges that were had at the time, but they can't be compared. That's the problem.
Okay. So my take on that usually is that at that time there was the other big element is nowadays the compliance part. There's a huge part of clinician's role where you have to do compliance checks. And going back 10 years, 20 years maybe, there were fewer compliance checks, there were fewer regulations to follow. So there's a lot more mentally to do, may not be physically, but there's a lot more in terms of mentally that you need to do now than you had to in the last 10, 20 years.
Absolutely. Absolutely. So, we're trying to manage, especially from an economical perspective, times are tougher.
Yeah.
So we're seeing a lot more social issues. We're seeing a lot more patients that are coming in with a multitude of problems that could be related to whether they're dealing with homelessness or dealing with issues that are related to poor health that's linked to outcomes socially. But I'd say the complexity of issues that we're dealing with now is also far higher compared to previously, because we now know more about conditions. We're also dealing with patients who are living longer, so having to deal with multiple comorbidities. So, it's a tricky situation, but I think with time, hopefully, there can be some resolution in terms of having an increased workforce with better working conditions, and hopefully that will help.
Super. Okay, now moving on to a bit lighter side. What does your life look like outside of clinics and outside of hospitals? What is it that I know we've talked about traveling, we've talked about your hobbies like acting and gym and training, but in general, so what is life outside medicine like for you?
So in actual fact, I'm actually taking a break from GP at the moment.
Okay.
So I'm taking 6 weeks out because naturally my last contract came to an end, and I'm actually staying on at the same practice but on a more permanent basis.
Okay.
But I actually went to the practice asking for 6 weeks as a break in between.
Okay.
And the reason why is because actually I had lost a little bit of myself outside of medicine, and that's what I want to try and regain back. And it was things like traveling, going away on holiday. It was things like seeing my family on a regular basis, which I wasn't doing as much. It was playing squash, playing paddle, which I also had stopped playing briefly, and getting back into a good gym routine. So all these things are what make me happy. And it was about using this time to try and regain that and rebuild a new working schedule that would allow me to have my non-negotiables and prioritize my work, but also prioritize my own interests as well, to create that good working life balance.
Fantastic. So good luck with that, and hope
Thank
you
you.
enjoy your next 6 weeks. Where are you in the 6 weeks? Are you in the beginning, in the middle, in the end?
Yeah, it's too near the end, but I'd say I'm about 2 weeks in.
You're 2 weeks
Yeah,
in. Okay. Okay. Now, advice for new GPs, existing GPs, IMGs, what would it be? So knowing what you know now, after 6 months of working as a practitioner and with all the experience that you've had, knowing what you know now, what would you give, let's say, your own self as a student, what advice would you give him now?
I would say really think about what specialty it is that you want to do, because ultimately the training is fairly long. It could be 3 to up to 10 years, depending on the specialty you choose. And if that requires you to take time doing trust grade fellow jobs in that role, just to get some more experience, then I would say definitely go ahead and do that. If it is GP that you're looking to go into, and I'd say fundamentally focus on the GP role itself, and there will always be topics that you find that you're a bit weaker at or you haven't come across as much of. So I know that the common things being common, I think a lot of GP trainees find dermatology quite difficult as they begin with, especially because we aren't exposed to as much dermatology in our medical school training, and it's not something we cover as much in the hospitals. In terms of, so that's an area that I'd say focus on, and there's always courses you can do alongside your training, and utilize your study leave. Utilize that to focus on the areas that you want to improve your knowledge on. In terms of qualifying and going into GP roles, I would say really have a think about what's important to you. Have a think about what days you'd want to be working. Have a think about where you want to be working. Have a think about how far the commute is. Have a think about, I definitely want to ask them about the administration work. So how much time is allocated to that? What's the expectations of the practice? What sort of responsibilities you have? And also I'd say don't lose yourself in the process, because ultimately we spend our life training to be doctors and training. So when that whole training process and journey comes to an end, it's almost like, okay, well, what's next? And I think it's about understanding, do the role, but also look after yourself at the same time, because you can lose yourself in the process.
Okay. Now, what helped you in terms of settling into one place? Like you said, you're extending your contract with the current practice. What kind of helped you in settling in the environment, with your colleagues, within the surgery, within the hospital that you're in? What were the key things that you said, okay, you may have worked elsewhere, but yeah, I like this place. This is why I like it. What was it?
I think the biggest factor for me is probably the team.
Okay.
I want to make sure I'm working in a team that are supportive, social, and it's fundamentally, it is a team environment. So you want to make sure that you get on with your colleagues, and that you can also they're approachable, so you can speak to them if you ever have any problems. The other parts that were important, I guess, is going to be, your working hours and expectations. So what are the practice expectations of you, and what's your expectations of a practice? So is it opportunities to develop, or, have a special interest role? Is it opportunities to get involved in medical education? Is there flexibility in the roles that you can have, and how you can develop?
Okay.
Yeah.
Now, finally, another question linked to that, and then we'll move on. What would be, so this is for GPs or doctors or clinicians coming from overseas, what would be your advice to them? I'm sure you've worked with loads. I'm sure you've seen how, what their practices are, how they work, what their routine is. I mean, what is it that will help them settle in?
I would say the most important part is understanding the NHS system. So spend time working in or shadowing in NHS hospitals to look at how things are run, what the NHS system involves, what the key goals are and the values, because ultimately it is a big part of how our society runs, and it is a key element. We have a great NHS system. The other thing to think about is probably just keeping on top of clinical guidelines. So obviously NICE will be helpful to look at in terms of how best practice is managed here, how conditions are safely treated, and because there may be a difference in management decisions and plans compared to other countries. In terms of the process of working, I'd say you need to make sure you probably have a look at the IELTS exam, because there is an expectation to be proficient in English at a certain standard. And then there is the expectation to do the PLAB exams as well, which is mandatory before starting work and before registering with the GMC. And then I'd say it's a case of looking at trust grade jobs wherever they are available. Obviously, with the recent issues with the specialty training posts and with the vast numbers of people applying and the high competition ratios, there was the recent bill for the UK prioritisation. So that is definitely worth looking into that to see how that will affect and impact your job applications. Because you may find that there are different priority groups and it'd be worth looking at, well, which one do I fit into? It's definitely worth still applying. So the new bill doesn't stop anyone from applying, but it may just differ in terms of how the priority is given out for job applications. I guess the other advice would be, if you are looking to move to the UK, it might be worth thinking about completing your specialty exams or completing your training if you haven't already started the process or already within the process of moving over to the UK, because then at least you can then apply for consultant jobs at a later stage and complete your training elsewhere.
Okay, fantastic, great advice. Now, we're going to come towards our wrapping up time or conclusion time. Now, any final advice, words, messages for, first of all, GPs, people like yourself in clinical, from clinical background, feeling stuck, feeling burnt out in their role? What would your advice be to them? I mean, not everybody's going to enjoy working for the team or with the team that they're working with now. What would be your advice to them if they're feeling stuck, if they're feeling that things are not moving for them, they're not happy where they are? One, and two, people who are feeling burnt out, especially. You've given loads of tips, but any final messages for them?
I'd say ultimately the hardest part for any GP or any healthcare professional who is struggling is to realise that it's okay to say that you are, and it's, we are all only human. So look after yourself and do whatever it is or whatever it takes to be able to put yourself first, because fundamentally if you can't put yourself first, then you won't be able to put your patients' needs first either. So whether that's speaking to the team around you to see what changes can be made in the workplace, if it's all related to work-related stress, or is it a case of, am I not spending enough time at home with my family, or is it a case of I'm not having time to get my fitness in? Whatever it is that needs to change, you need to find a way to do it. And ultimately, a lot of it can be related to work. So if that is the case, it's about taking the right steps and speaking to people, because if you don't speak up and speak about it, then people can't help you. So yeah,
absolutely. Super. Your personal plans, and professional plans going forward. I know you mentioned that you don't know where your content creation will go. You'll see how that goes. And in terms of your medical profession, where do you see yourself, let's say in the next 5 years, 10 years? How do you see, where do you see yourself in the future? Or where would you like to be?
Yeah, where would I like to be? I'd like to be on a beach, on a sun lounger, reading a book.
I don't want to mention Donald Trump, but yeah, let's go.
No, so I'd say fundamentally I see myself being a GP and always being a GP. So whether that's remaining in a salaried role or being a partner, I don't know. But I would... But yeah, so fundamentally, majority of my time will be working as a GP. I'm going to continue with this online presence and the content creation. I think I'm going to move more into the direction of providing more health education topics online and also sharing more day in the life videos when I return to work. I'm also currently doing a dermatology diploma. And I'm also looking at roles within preventative healthcare, whether that may be in NHS or private, I'm not sure.
Okay, fantastic. So, anything you'd like to share with our audience? Anything you want they should follow you, your Instagram handles? Please feel free to invite everyone.
Yeah. Yeah, so thank you for listening. I'm Dr. Harnek Kailey, London-based GP, and my social handle is at the London GP. And yeah, follow for more health education tips, follow for more advice around GP, and just for general tips and tricks on managing a work-life balance.
Super, fantastic. Harnek, it's been an absolute pleasure.
Thank you.
It's been fun talking to you and understanding your experiences. Guys, this was Dr. Harnek Kailey. If you'd like to ask any questions, we'll have his Instagram link in the description. Please feel free to comment. Share the video with your friends, your colleagues, your family. If you'd like to us to present more stories like this, please do send us a message, drop in a comment. As always, like, share, subscribe. Thank you very much. Goodbye.